I'm going to have surgery in a hall. Next time you see me, please be dime. All right, what do you want to know about me? Basically, I had this dry cut on my mouth for like over a year. How many doctors did I go to? I think I went to the cancer clinic, saw my nurse practitioner, saw the doctor there. They both said keep an eye on it. And then I had a different appointment with a dermatologist. I mentioned this dry cut, and she said the exact same thing. Keep an eye on it. So I kept an eye on it, and my eyes just didn't help it heal. So I escalated basically right after that because there's no way you should have some sort of wound that doesn't heal after a year. So I went to my family doctor and I mentioned it to her, and she's like, that's ridiculous, why? So she referred me to the oral surgeon.
This side lumped, double lumped.
So basically, I go into the oral surgeon, he looks at it, he's like, yeah, we want to biopsy it. They biopsy it, it comes back as dysplasia. If normal skin's here, cancer's here, it's somewhere in the middle. Like, it doesn't look normal, but it's not fully cancerous yet. I've had a liver biopsy, a bunch of skin biopsies, bone marrow biopsies. Definitely less painful, but feeling the tugging of the suture is uncomfortable. But the thing was, the biopsy basically removed the entire thing. So we were just like, okay, let's keep an eye on it. We just didn't worry about it. It was like, all right, actually just watch out, see if it comes back, because it's dysplasia, but it looks like it's gone. Then a few months later, I go on vacation. And somewhere around that time, I noticed the dry patch is back. It looks like a little dry cut. It's probably like, what, 5 or 6 millimeters long. So when I come back from vacation, I go back to the oral surgeon, and he's like, all right, let's just do a total excision, cut this whole thing out. The pathology report from that is carcinoma in situ. They also didn't get clear margins, which basically means, oops, we missed a spot. And they refer me to the cancer clinic at Victoria Hospital in London. So eventually I'm gonna have to brush one tooth at the very back. I'm waiting for them to follow up to see when I go in. At the same time, I come home from work one night.
But wait, there's more.
And I noticed this swelling around one of my teeth on my gums. I'm thinking this could be as a result from my jaw injury back in July, where they put screws in and they had warned me that there's a risk I could develop a root canal. So I just figured, okay, this is probably like something related to that, because it's basically in the same spot one of the screws were. If you want to see me fall flat on my face, you can check out my video of how I wiped out the movies and ended up breaking my jaw in 2 places. So I went to go see my dentist. He basically had no idea what was going on. He said there might be some bone loss. And then he said, yeah, go see the jawbone people. I don't know what they're called. But anyways, he said, yeah, just go find one of them. And that was basically it. I call my jaw surgeon and I tell him, and he takes a look and says he wants to biopsy my gums now because, as he put it could be leukemic infiltrates, which basically means I've relapsed from leukemia. He said it'll be quick results, only 4 weeks. Like, frick.
Is my mouth swollen or my face? Wait.
So these are 2 separate things. So I go to this appointment thinking they're going to come up with a plan to remove the remaining cancerous cells in my lip. They start talking to me about the results of my biopsy of my gums. I'm like, what? Like, what are you talking about? This is a separate thing. And they said, no, like, that's also squamous cell carcinoma. I said, okay. Like, what? So at that time, this is the end of 2024. They want me to come back in the beginning of January, and they're going to come up with a plan for both of these things.
I wish I could look in there. It's too swollen, I can't even see.
I go in there thinking they're going to scrape a bit of tissue out and cut a bit of this out, but instead they want to remove 4 teeth, cut a bunch of the gum away right to the bone, because there was some tissue at the back that was questionable. It wasn't cancerous, but they were like, because I'm immunocompromised from the transplants, they don't want to take any risks of leaving some and then it spreads. And the radiation doctors there also said they don't want to do radiation. If you do it in immunocompromised people, specifically in the gums, it tends to have worse outcomes.
I just took a drug. What time is it? What?
Yeah, so after a few weeks, maybe a month, they called me in for surgery beginning of February. yeah, they're going to cut out big chunk here, remove 4 teeth, cut out a bunch of the gums, and the rest is history. Coming out of the surgery was very painful, very uncomfortable.
I just came back from surgery this morning and then I had a nap. So I'm feeling a little better. It's starting to get painful though, so I took drugs. Double the dose they recommended. No, I'm just kidding. Yeah, lips are really dry. Can't really lick them. Cut's bigger than I thought it was, but what can you do, right? Once you're under, they do what they want to you.
I didn't know exactly the extent of what they were going to do. And when I came out, my mouth absolutely mangled inside. Gums were splitting apart and stuff's peeling, and it was not fun. It looked gross. Stitches everywhere. I got huge gash here, and then on the right side I got missing teeth and gums cut out. So trying to eat, I gotta like do some airplane maneuver, like in this side and then over to that side. Yeah, it wasn't fun. And then on top of that, I have some nerve damage. So this side right here is painful. It's like when you're freezing cold, like your fingertips or something. It's like you're numb, but you're also in pain. And when I tried to like gurgle mouthwash, it just kind of spews out. I can probably show a cameo of that just for giggles. Oh, and then I got an infection here. They gave me antibiotics. The swelling's been going down, so. Moral of the story, I guess, would be if you're a transplant patient, you gotta watch out for this stuff, even if something looks minor. If the doctors say keep an eye on it, maybe consider getting a second opinion or a third.